Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Let's look at today's top medical news. Could delirium be a strong factor for dementia? A study published in the journal The BMJ found that delirium is a strong risk factor for dementia and death among older people and has a strong independent effect in this clinical population. Delirium is a sudden change in a person's usual mental state. Symptoms include agitation, confusion, or being unable to stay focused when awake. Delirium is much more common in hospital patients and older people. Previous observational studies have suggested an association between delirium and subsequent dementia, but the relationship remains unclear. For the study, researchers in Australia analysed data from 626,467 patients aged 65 years and older with no dementia diagnosis who were admitted to hospital before January 2009 and December 2014. Of these patients, 55,211 had at least one recorded episode of delirium and were matched to another 55,211 patients without delirium by age, sex, frailty, reason for being in hospital, length of stay in hospital, and length of stay in the intensive care unit. These 110,422 patients were then followed up for 5 years to see how many of them were diagnosed with dementia. Collectively, 58% of patients died and 17% had a newly reported dementia diagnosis over the follow-up period.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
The results reveal that patients with delirium had a 39% higher risk of death and 3 times the risk of being diagnosed with dementia than patients without delirium. The relationship between delirium and dementia was stronger in men than women, and each additional episode of delirium was associated with a 20% increased risk of developing dementia, which is the dose-response relationship. The researchers discovered that among hospital patients with at least one episode of delirium, the risk of receiving a new dementia diagnosis was 3 times higher than for patients without delirium, and each additional episode of delirium increased the risk by 20%. While our results are consistent with the hypothesis that delirium plays a causative part in dementia, they are not conclusive owing to the fundamental limitations of observational studies in determining causality. Nevertheless, the results of this study provide valuable insight because prospective randomized controlled trials are unlikely to be conducted, conclude the researchers. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.